Thank you very much, Jim. And again, thanks everyone for being here this morning. I want to begin with a quote from Hiroshi Nakajima. He, way back in 1988, he said, "We must recognize that most of the world's health problems and premature deaths are preventable through changes in behavior and at low cost." And I would add, and through education. I'd also argue that if we look at the major public health and global health challenges around the world today, these demand a cross-disciplinary and collaborative approach. Whether we're talking about the types of emerging infectious diseases and the human behaviors and choices that drive these, and Jim has already mentioned this, whether we're thinking about the creative approaches that are going to be needed to feed the estimated 9.4 to 9.7 billion people that will inhabit the planet by 2050, and how are we going to do that without destroying that very planet that we all depend on? The incredible need to expand access to education for children and to empower women around the world in personal relationships, in financial decisions, in decisions in governance, and so on, in continuing to combat the overwhelming cost of early childhood death on families and on societies. And I think if we want to have health professionals who are adept at being able to function across disciplines and in a collaborative way, we need to infuse that kind of thinking at the level of education to begin with. So what I'm going to do today is to try to make the case that I believe strongly in, which is that public health and global health education provide venues by which we can bring students across multiple disciplines together to learn together and to learn how to cooperate and to work cooperatively together. And I'm going to give you two primary examples from the UW-Madison, not because I'm trying to promote our programs. These simply happen to be the two that I know the best. The first is our cross-disciplinary Master in Public Health degree program. This began with conversations way back in 2003 and was launched in 2005. And I think what's important is that it was launched with a very intentional cross-disciplinary perspective from the very beginning. This was not an add-on. This was really at the very root of what we began. And I've just highlighted in red a few of the words that I think are important as we look at the mission statement and the goals of this program. You can see that the concept of developing a diverse workforce across disciplines, comprehensive understandings of issues, community-based, a prevention basis, these are really part and parcel of what we sought to achieve from the very beginning. To do this, of course, you need a multidisciplinary faculty. And although I know you don't know these people, I can look at this group and say, you know, we have folks representing climate change, environmental health, epidemiology, pharmacy, biostatistics, global health, environmental health, again, nursing, and so on across the board, and veterinary medicine. And we have been able to achieve this in among our students. And I'm just giving you a sense of our demographics. We've had a little over 400 students enter the program to date. We began with 2 dual degree programs, an MD MPH program and a DVM MPH program. I would point out that those 2 dual degree programs went before our University Academic Planning Commission simultaneously as a pair of programs that went up for approval together. We've since added nursing dual degrees, pharmacy dual degrees, law dual degrees, Master in Public Affairs and an MPH dual degree, and so on. And our dual degree students represent about 1/3 of all of our enrollees. And I've just included one quote at the bottom from some of our exit interviews, and this is very reflective of what we hear from students, indicating that they really are quite appreciative of the cross-disciplinary perspective of the program. Similarly, and at about the same time, we began developing global health programs at UW-Madison. This began in 2001 with an International Health Advisory Committee. That committee morphed in 2005 to a Center for Global Health that, again, was very intentionally cross-disciplinary among all of the health profession schools on our campus. I think we're in a very positive position when it comes to thinking about collaborative cross-disciplinary education, because we're one of the few institutions in the country, not the only, but one of the few, that have almost all of the health professional programs located within sort of a long 3-iron of each other. Okay, the only program that we don't have, unfortunately, is dentistry. And then in 2011, we really took the next step, and I think speaks very much to Malcolm's comments and others, is we moved from being cross-disciplinary among the health professional programs to cross-disciplinary across the entire campus. Agriculture, engineering, social work, law, even the arts and humanities and education and agriculture and so on, okay? So let me tell you a little bit about what we do. Among the different activities of the Global Health Institute, as it is now known, we have very strong programs in education, including certificates in global health at both the undergraduate and the graduate health professional level. And again, I've just tried to highlight in red for you some of the things that point out that, again, fundamental desire to be cross-disciplinary from the very start. In support of that certificate program, we have faculty-led summer field courses in 3 different countries. These are opportunities by which very intentionally students from across the health professions, and often folks from agriculture and from engineering as well, travel together, live together, get sick together, learn together, reflect together on what they're experiencing, visit communities together, learn how to do community transect walks and so on together, okay? And these are the goals that we have for these faculty-led field courses. And again, you see that very intentional cross-disciplinary perspective. One of our most long-standing programs takes place in Ecuador. This program is actually led by an anthropologist, not by a physician, not by a veterinarian, not by a nurse, and so on. It's led by an anthropologist with the idea that we want to look at health and well-being, and we want to look at the intersection of health and well-being in humans and in animals through an anthropological lens. And I'm sorry Susan's not here today. She would probably appreciate this. We have a program in Thailand. Let me go back for a minute. Our program in Ecuador is actually conducted in collaboration with an NGO, not with a local university partner, with an NGO called Andean Health and Development. Our program in Thailand is conducted in collaboration with a university partner, with Mahidol University in Bangkok. This program has a strong focus in tropical medicine and in community health. Students in both Ecuador and here in Thailand live in communities, they live in homestay circumstances, and they're very much embedded in the communities where they are learning and working. And then our third program is in Uganda. This is, again, has a strong focus in community health. It began with a strong focus in understanding what it meant to manage HIV/AIDS patients in a developing country setting. As with our MPH program, if you're going to have a cross-disciplinary program for students, you need to have a cross-disciplinary group of faculty in support of that. And I'm just trying to demonstrate for you here that, in fact, that is the case. This is a challenge. Make no mistake about it. It's difficult to get these folks to all come together, but we have really a great core of individuals for whom this is a very important part of what they do every year. And similarly, again, a cross-section among our students representing human medicine, veterinary medicine, nursing, pharmacy, and others in a more episodic basis. These are comments from an alumni survey of our field courses, and I'm not going to read these to you, but again, I've highlighted in red the areas that point out that students do indeed value this cross-disciplinary perspective that they are able to achieve through our global health programs. I wanted to also just point out some other existing programs and some other ideas for ways that we can bring students across disciplines together and educate them together. There are programs of shared coursework. Tufts University back in the early 90s had a program where the basic science courses for veterinary medical and human medical students were taught together. We saw, of course, the model that looks to be working so successfully at the University of Iowa between physicians and PA students. I would argue that perhaps we should be thinking about kind of reimagining these models in the future. We've talked about a number of different case studies that bring together collaborative groups of students, the Clarion public health case studies that have been going on for many years, the One Health case studies that Jim just mentioned, the Emory Global Health case studies, the DC Public Health case studies that we heard about yesterday as well. As we begin to develop competencies around interprofessional education, around global health, around One Health, I think these competency groupings can also be drivers of collaborative educational models. And then finally, of course, the use of technology and how that can be a bridge across disciplines as well. So I want to leave you with two quotes. One from the FAO, the Food and Agriculture Organization of the UN, that annually posts a study of the status of livestock and food around the world. And in 2013, they said, in today's world, we humans have become increasingly linked, not only to each other, but also to all other life on the planet. Human health has become ever more intertwined with the health of our environment and the animals that populate it. The animals we rely on for food, draft power, saving, security, companionship, as well as the wildlife inhabiting the sky, the land, and the sea. And finally, a quote from one of the giants in One Health before we really talked about it as One Health, Fred Murphy. Fred was a prominent infectious disease veterinarian, worked at CDC, worked on behalf of WHO and others for many years. And I love this comment: we must build a cadre of career committed professionals with a holistic appreciation of several medical and biological sciences. So I thank you for your attention, and I will turn it back to Jim.